Hey y'all, this is Dr. Tiffany. I hope you're doing well. This, however, is a disgusting example of profits over patients that I'm about to tell you about. So, you wake up in the middle of the night, you're 38 weeks pregnant, and you feel a few twinges. Over an hour, you feel about 5 or 6 of them, and they seem to get a little stronger, and you think that maybe you're starting labor. So you do what most people who care about whether or not they give birth safely do. You go to the hospital and you go to the OB department where your OB practice is at, and you go up to the OB floor and they check you out. And they tell you, no, it's Braxton Hicks contractions and you're not in labor yet. You can go home. So you go home. You go into labor and, a week later you deliver your baby, and then you come home from the hospital and already in the mail is a bill for $5,000. And you think, what the hell? And then you realize it's for the visit that you had a week ago. And, what they've done is private equity firms that own OB staffing companies now have set up things called OB emergency departments. These are not labeled, they are not part of regular emergency departments. They're up in the OB floor in the triage room, just like the triage room's always been there. It might have a new plaque on the outside, which I'm sure everybody notices when they're, thinking they're in labor. So 3 out of 4 of the staffing companies that set these up are actually associated and owned by private equity firms. They promise increased patient satisfaction, but they bilk people with gigantic bills instead. This would be one thing if this actually went to healthcare workers, but none of that actually goes to like doctors and stuff like that. And these covert ERs will give these huge bills for like $5,000 or $3,000, of which the doctor sees $30. But the bill's sent out in the doctor's name, so they paint us as the bad guys. So, meanwhile, physician pay, especially if you're going to count it as an ER, has actually been stable and kind of declined in the past few years, while the private equity profits are soaring and patients are paying the price and doctors are leaving healthcare. This should make you mad. This is a bait and switch. This used to be part of the package. Now it's a pure profit machine. I love you. Stay safe.